Thanks for joining us today in our WA Group webinar series. Today's topic is getting ready for Medicare and what you need to know. My name is Kerry Colpitts and I'm an employee benefit consultant with the WA Group. I'm also a Medicare specialist. And in today's webinar, we're going to go over a couple of things, including reviewing the types of Medicare plans that are available to you, the enrollment process of those plans. We're also going to talk a little bit about penalties for delayed or not enrolling in Medicare. And finally, we're going to finish up with what other options are available for you, either continuing with your employer plan, moving to a Medicare plan, or a combination of the two. So let's go ahead and get started. When you're 64 years old, there's several things that you need to consider and be conscious of, including things such as Social Security, retirement, your physical health and financial health, and also Medicare. And that's what we're going to do today, is we're going to talk about Medicare. And first of all, what is Medicare? Well, Medicare is basic affordable healthcare coverage for beneficiaries or people who have paid into the Medicare system through 40 quarters of paying Medicare premiums through their employer, or a spouse of someone who is qualified as a beneficiary. Typically, people are eligible for Medicare if they're 65 years old, they've been permanently disabled for at least 24 months, or diagnosed with end-stage renal disease or kidney failure. You can't be denied coverage due to pre-existing conditions for Medicare, and you can't get canceled once you are enrolled in Medicare. Again, Medicare is a federal and administered by CMS, or the Center for Medicare and Medicaid Services. Medicare started in 1965 and was signed by President Johnson. The first two Medicare recipients were actually former President Harry Truman and his wife, Bess. There's different options under Medicare. As shown here, Parts A and B are known as Original Medicare. And again, they're provided by the federal government. If you've qualified, if you've paid into Medicare or your spouse has paid into Medicare, you are eligible for Medicare's Parts A and B. Medicare Part C is the ability to buy a private insurance plan that covers your Medicare A and B benefits and also provides additional benefits. And these are called Medicare Advantage plans. There's also an optional Part D plan for prescription drugs that are also provided by insurance companies under the direction of Medicare. So what are the different parts of Medicare? Well, Part A of Medicare, which again is provided by the federal government, covers inpatient hospital stays, skilled nursing facility stays, hospice, and home health care. The other part of Original Medicare is Medicare Part B, which covers physician services and other medical provider visits, outpatient care, durable medical equipment, and home health care. You need to realize, though, that for most people, there is a premium for Part B. And that premium is determined by Medicare when they get your information from the Internal Revenue Service. When you become Medicare eligible, your Part B premium is based on what your income was 2 years prior. So in 2020, if you become newly eligible for Medicare this year, it's going to be based on your income in 2018. For most people, $144.60 is what they are going to pay for their Part B of Medicare. As I said before, there is no premium to Part A of Medicare, but there is a premium to Part B of Medicare. And if it's a couple, the husband and wife, based on that fee of $144.60, that's what will be charged for each of you, as Medicare is an individual option and not a family plan. So a couple of things, though, that you need to be aware of is Original Medicare doesn't cover everything. There are many out-of-pocket costs that Medicare leaves as your responsibility, such things as a Part A and Part B deductible that Medicare does not cover, that you would be responsible for. Also, Medicare only pays 80% of Part B services. So physician services, no matter what the amount, Medicare is only going to cover 80% of those. So if you just have Original A and B of Medicare, all your physician services, not only will you be responsible for a Part B deductible, but you're also going to be responsible for 20% of the services charged under Medicare Part B. Also, Medicare, Original Medicare A and B doesn't cover outpatient prescription drugs. They don't cover inpatient hospital and skilled nursing care charges above the Medicare limits, eyewear, hearing aids, routine dental care, and most healthcare services received outside of the US. As I said, there is no annual or lifetime limit under what you may pay in out-of-pocket costs under original Medicare A and B. As I said, there are other options under Medicare. One of those options is buying a private plan, also called Medicare Part C or a Medicare Advantage plan. And under a Medicare Advantage plan, what you would do is you'd assign your Part A and Part B benefits to a private health plan that administers benefits on the behalf of Medicare. These plans are authorized by Medicare and they're contracted with by those insurance companies to offer those services. Some things that you need to be aware of, though, when you purchase a Medicare Part C plan or enroll in a Medicare Part C plan, is it's actually replacing your Part A and B of Medicare. Now, you still have your Medicare card in your wallet, but Medicare is not going to cover any of your services because they're relying on the insurance company, the one who provides you the Medicare Part C plan, to provide all benefits for that coverage. Medicare Part C plans often include Part D coverage. They often include prescription drug coverage as part of the medical plan. So unlike original Medicare, Medicare Part C plans can offer additional benefits that are not covered under original Medicare, such as Part D services, eyeglasses, contact lenses, hearing aids, and a variety of different benefits that are not that you're not eligible for under original Medicare. You also need to be aware of the fact that if you enroll in a Medicare Part C plan and are paying a premium for that Part C plan, you may also be, or you will also be paying a Medicare Part B premium as well. Medicare Part C plans, Medicare Advantage plans, they can't turn away Medicare eligible individuals. You have an open enrollment on an annual basis to enroll in a Medicare Advantage plan to upgrade or change carriers on an annual basis based on your desire and your needs. And as I said before, Medicare Advantage plan, one of the reasons that they got their name is that they can provide additional benefits or an advantage to having just original A and B of Medicare. Part D of Medicare is also private insurance that is sold by insurance company, and Part D plans allows private health plans to offer Part D prescription coverage under a contract with Medicare. So like a Medicare Part C plan, a Medicare Part D plan provides additional benefits that original Medicare A and B do not provide. These private or Part D prescription drug plans are private plans that help pay the cost of prescriptions based on the plan's formulary. There are monthly premiums to Part D plans. And although these are optional, there are penalties for late enrollment to these plans. So if you wait and you don't enroll when you're first Medicare eligible, you may be subject to a penalty later on for not enrolling on a timely basis. And under Part D prescription drug plans, you can only enroll or leave or change plans at certain times during the year, usually at the first of the year. Now, how do different plans work with Medicare? As I said before, Part A and Part B of Medicare, which is called original Medicare, is provided by the federal government. There is a premium to Part B, but not to Part A. But again, since Medicare A and B don't cover all of your services, many people opt for additional benefits to go along with their original Medicare. One option would be a Medigap or a Medicare supplement plan. Another option would be a Medigap plan or a cost plan. And I'll talk a little bit about those as well. But what a Medigap plan is it fills in the financial gaps that Medicare leave as your responsibility. So as we talked about earlier, that there is a deductible under Part A and Part B, and there is a 20% coinsurance under Part B. Well, many Medigap or Medicare supplement plans fill in what Medicare leaves as your responsibility. So that Medicare Part A deductible, a Medigap or Medicare supplement plan would pay that for you. Also, the 20% coinsurance that is not covered under Medicare Part B, a Medigap or a Medicare supplement plan would pay that for you. Also, what a lot of people do is they purchase a Part D Medicare drug plan separately from a Medigap or Medicare supplement plan, because Medigap or Medicare supplement plans can only cover the remainder of what Medicare has left as your responsibility. A supplement or a gap plan cannot pay benefits that Medicare doesn't authorize coverage. And again, Medicare doesn't cover prescription drugs outside the hospital, so a Medigap could not pay for those services, although you could buy a standalone Part D plan to do that. Also, Medicare supplement and Medigap plans sometimes require Medicare or require medical underwriting. So if you're enrolling when you're first Medicare eligible, you come on with no pre-existing conditions and no underwriting. But if you delay and wait to enroll in a Medicare supplement or Medigap plan until later on, you could be denied coverage because the insurance company will underwrite you. Also, Medicare Part A and B, known as Original Medicare, there is a premium for Part B, and there's going to be a premium for a Medicare supplement and a Medicare Gap plan as well. And again, these Medigap plans or Medicare supplement plans, they're not under the direction of the federal government or CMS. Medigap and Medicare supplement plans are regulated by the state in which you live when you purchase those. Now, there's also Medicare cost plans, and Medicare cost plans are similar in the scope to Medicare supplement plans, but they don't supplement. Most of the time what they do is they supplement Part A and replace Part B. So it's a bit of a hybrid. And Medicare cost plans, you still have to pay your Part B premium to Medicare, and there's going to be additional premiums for a Medicare cost plan as well. But Medicare cost plans do offer additional benefits like Medicare Advantage plans. They can provide for services that Original Medicare does not cover. Although most Medicare cost plans offer Part D coverage, you can choose to have that Part D coverage as part of your Medicare cost plan, or you can buy a standalone prescription drug plan if that better suits your needs. Now, Medicare cost plans are not available in all counties. We're doing this webinar from Minnesota, and in the state of Minnesota, Medicare cost plans are available in only about 1/3 of the counties in Minnesota. So your final determination of what plan is going to work best for you is also going to be contingent on the county in which you live. As I said, there's also standalone prescription drug plans or prescription drug plans that come in two different types of services. One are bundled coverage, and the other is standalone coverage. What bundled coverage is that your Part D, your prescription drug coverage, is part of the medical policy that you buy. So as I said, most Medicare Advantage plans and Medicare cost plans can include and do include prescription drug coverage. This is what is called a bundled option. Standalone coverage is for people or individuals who only purchase original Part A and Part B of Medicare and use just a prescription drug plan as a standalone. Or it also can be paired with health plans such as Medicare cost plans, supplement plans, and Medigap plans. So you can use standalone plans in a variety of situations. How prescription drug plans work is that for most people, what they're going to have is initial coverage, which for most plans is you would be responsible for 25% of the cost of those prescriptions, and the plan would pay 75%. This number is also come upon by the fact that you may have a deductible to pay first, but in this initial coverage, you have coverage of about 25%. The coverage gap, or number two, is that once your plan and you together have paid $4,020 per year, then your generics and brand name drugs are all covered at 75%. You would pay 25% for those. When you get to level 3 or catastrophic coverage is when you have spent $6,350 out of pocket. Once you get to that level, you'll never pay more than 5% for any generic or brand name drugs for the rest of the calendar year. Now, I've talked about Medicare plans, but it's really important to know how and when to enroll in Medicare, and here's some information. If you haven't filed for your Social Security yet, or you will not be receiving Social Security, you need to be proactive in enrolling in Part A and Part B of Medicare. You can do so by contacting Medicare at 1-800-MEDICARE, contacting your local Social Security office and enrolling through them, or the easiest process is going to their website, which is medicare.gov, and clicking on the link to enroll as newly eligible. If you've worked for the railroad, you're going to need to call the Railroad Retirement Board to learn more about signing up for Medicare. If you're already receiving Medicare benefits, if you're already receiving Social Security benefits or the Railroad Retirement Board benefits, you're going to be automatically enrolled in Parts A and Part B of Medicare when you become Medicare eligible at 65. Since there is a premium for Part B, you're also going to be sent information how to disenroll in Part B if you do not want Part B. Now, when do you need to enroll? Well, most people are going to be Medicare eligible the first day in the month in which they turn 65. If your birthday is the first of the month, then you become eligible the previous month. So most people should start that Medicare enrollment process 3 months prior, because that's when you can start enrolling in Medicare, contacting your local Social Security office, or going online at medicare.gov to enroll. So if you're going to be eligible for Medicare July 1st, you can start that process in September for a December 1st effective date. If your effective date, or if you do not enroll in December when your birthday is, if you enroll in January, February, or March, you can do that as well. You have a 7-month window. But if you enroll after your 65th birthday, your coverage will be effective the first of the month following the date that Medicare receives your application. Now, there are different coverage combinations of having Medicare and the policies that I talked about. Again, one is having original Medicare, where you get Parts A and B from the federal government, and you buy a standalone prescription drug plan. How do you enroll in that? Well, you'd enroll with Medicare through the medicare.gov website or the local Social Security office. But to enroll in a Part D plan, you have to join a private Medicare-approved Part D plan and make sure that the coverage that is being provided is creditable coverage. There's also combinations where you can have Part A and B of Medicare, a standalone prescription drug plan, and a Medigap or Medicare supplement plan to cover those services such as the deductibles and the co-insurance that Medicare Part A and B don't cover at the hospital or at the doctor's office. Your process then is the same, is that you would enroll in Part A and B of Medicare with the federal government, but your prescription drug coverage and your Medicare supplement or Medigap plan that works with original Medicare would be done through a private insurance company. You also can enroll in a Medicare Advantage plan and a standalone prescription drug plan if that Medicare Advantage plan doesn't offer prescription drug benefits, or a Medicare Advantage plan that offers prescription drug benefits, also commonly referred to as an MAPD or Medicare Advantage prescription drug plan. And since this is bought by private insurance, what you still have to do is you still need to enroll in Part A and Part B of Medicare to give you the option to then purchase or enroll in a Medicare Part C plan. Again, Medicare Part C is a private type of Medicare plan that you have the ability or the option to enroll in if those types of plans are available in the county in which you live. Again, you have to enroll in Medicare Part A and B first, and you will have to pay your Part B premium as long as you're covered under a Medicare Advantage or Medicare Part C plan. That Medicare Part B premium is going to be charged to you. One thing I didn't talk about is how you would pay that Medicare Part B premium. If you're enrolled in Social Security, that Medicare Part B premium comes out of your Social Security check. If you are not collecting Social Security yet, or you've put that off, Medicare will actually bill you quarterly for the cost of your Medicare Part B premiums. So keep that in mind when you're looking at financing your health insurance purchases. Another coverage combination is having parts A and B of original Medicare with a standalone prescription drug plan, and having a Medicare cost plan as additional benefits for your medical coverage. Again, you'd need to sign up with Part A and B of original Medicare and continue to pay your Medicare Part B premium. But then you have the opportunity to join a private cost plan that works with original Medicare. One benefit of having a Medicare cost plan is that at any time you can return to having just original Medicare anytime during the course of the year. You do not have to wait until January 1st, which is typically the annual election period. You can do it at any time during the course of the year if you're enrolled in a Medicare cost plan. Now, we talked a little bit about the types of plans, the enrollment in those types of plans, but I really want to talk to people about things that they should consider when they are reaching Medicare eligibility, because you do have several options if you are going to continue working. You can remain covered under your employer plan or your spouse's plan. You can remain covered under your current medical insurance and enroll in a standalone Part D plan if your employer's medical plan isn't a creditable coverage. You can enroll in a standalone Part D plan. You also need to consider that who is the primary carrier when Medicare and other insurance are in place. Now, this is really important because people think that, well, if I have health insurance, then it's all good and I have no penalty, even though that I'm already post 65 or I've already turned 65 years old. And that's not entirely true, because when you work for a smaller employers that have less than 19 employees, Medicare is primary to a group policy. If you're working for an employer that has more than 20 or more employees, then the employer's plan is primary and Medicare is secondary. So if you are working for an employer that has less than 20 employees, you need to be sure whether you're going to be penalized if you choose to continue working past age 65, past your Medicare eligibility, and do not enroll in Medicare Part B. So I want to let everybody know that they should be looking out for this information when they're getting ready for Medicare, because this could severely hinder you in the future, because there's penalties for delaying your Medicare enrollment. There's a penalty of 10% if you do not have a Part B premium for every year that you did not enroll in a medical plan. In essence, what's that saying is, instead of paying, earlier that we talked about that $144 a month, if you don't enroll that first year, you'll still pay the $144 a month, but you'll also pay 10% additional in a penalty. And again, that 10% is for every year that you did not enroll in a Medicare Part B premium when you were instructed to do so or required to do so. That penalty also is a lifetime penalty. It's not for a year, it's not for 2 years, it's for the remainder of the time that you're covered under Medicare. So that 10% penalty or 20% penalty for 2 years or 30% penalty for 3 years is always going to be there. You're never going to get out from underneath that. So make sure that if you need to enroll in a Medicare Part B plan, that you get some good advice. Also, there's a penalty if you do not enroll in a Medicare Part D plan when you're first eligible. That penalty doesn't seem as stiff, as it's only 1%, but it's 1% for every month that you did not enroll in a Part D plan or have creditable coverage under a Part D plan. So it's actually 12% a year, and it's 12% of the average prescription drug cost plan that is sold. So if the average prescription drug cost is $50 and you wait 1 year to buy that, you can buy prescription drug coverage, but it'll cost you $50 for the drug coverage, plus a $6 penalty. So you need to be aware of, are the plans that I have, are they creditable? Am I going to be penalized? And you need to figure that out before you retire, because many people find out after they retire that they've been penalized since they became Medicare eligible and didn't do anything at that time. You also face a penalty of further delaying your enrollment in Medicare if you do not do it on a timely basis. And there's a lot of scenarios that might occur. And rather than go through all the scenarios, I'm going to invite people to reach out to me about these penalties and about whether they're subject to a penalty based on their current plan or their spouse's plan, or the plan that they think they're going to keep, even though they're going to continue working past age 65. I invite everybody to reach out to me so that we can have a discussion about whether or not penalties would apply, what's the best options, are there Medicare cost or advantage or supplement plans in your area. This is my information. And again, I'm an employee benefit consultant with the WA group and a Medicare specialist. My telephone number and my email are here. So please give me a call, reach out to me. Consultation is at no cost. I want to help people make sure that they're finding the most appropriate plan. So give me a call, send me an email. I'll be more than happy to talk with you. Thanks very much for listening today, and everybody stay safe. Take care. Goodbye.